IPL actually stands for intense pulsed light. A common misconception is that IPL is a laser. It's actually not. A laser is a single wavelength of light. One of the things that's great about IPL is that it is a fantastic tool of choice if you're trying to get a lot of treatments into a relatively low budget. You know, IPLs are generally speaking less than a laser to produce, and consequently they're usually a little more affordable. But you can do things like acne treatments, hair removal, vascular treatments, pigmented lesions, and so you can really do a lot with IPL in one box.
I always like to cleanse the patient's face myself. The reason for that is many times we'll ask patients, do they have a cleanser on? Do they have any makeup on? And they'll say no, or a moisturizer. Today, so many women wear a tinted moisturizer or mineral makeup, which can really kind of steal the light and cause a burn, actually. So I never trust the patient when they say they don't have anything on, and I don't think if they're having a nice photofacial that they should have to go wash themselves. So what I do is I have a wet 4x4 in one hand, and I just have some of my gentle cleanser, and I just go over the face till I see no makeup or anything on the wet side, and then I switch and I dry this side and I wash this side. Just want to make sure I get all the oils off, any residual makeup, tinted moisturizers, sunscreen, powders, anything like that. As women, you know, sometimes we don't wash our faces as well at night, and then this kind of builds up. So this is perfect. I feel good about starting on a fresh, clean face now. I'm going to give my patients some goggles. I really insist that my patients wear a metal goggle anytime I'm working on the face, with the actual tightening behind it. Can I have you lift your head a little bit, Beth? Thank you. Hang on, I'm just going to tighten this up for you. The reason for that is IPL scatters. And if the patient's goggles are not on tightly, the light can come under the eyes. And because it is attracted to red or vascularity, it could attracted to the retina vessels. So I like to make sure my patient is comfortable with the goggles. They're in place, and now we'll get started. You're going to feel me put a little gel, clear gel, on your face. And I do this with a tongue depressor. I just like to paint the face so that it provides cooling to the skin as the IPL works, as well as helps my handpiece move smoothly. Does that feel cool and calming on your skin? Good. Sometimes we use more of a lighter lotion, or sometimes we use a heavier gel. What I do is really, I depend on whether or not how active I want to be. If I want a lot of energy and the patient is very fair-skinned, I will use a very light lotion as my guide to conduct light. If the patient is a little more tan, I want a lot of gel to act as a protective barrier and just kind of slow down my treatment. So now that the gel is applied, I'm going to come over to my Light Series IPL handpiece. I have the 550 small filter. I've got it set for skin type 1 to 2, 15 millisecond pulse duration, 16 joules fluence. When I set the machine up, the machine recommended 18, and I am always just conservative. I like to do 3 pulses a little bit lower and see my tissue response and then work my way up. So that's just the way I've been treating patients for 22 years, and I still do it that way. There's a lot of variables, particularly in IPL. So I always just like to start slowly and kind of see where I'm at. We've got our machine now in a ready mode. It's asking me to calibrate. We're just going to acknowledge. About every 3 to 4 months, you need to actually go through the calibration. It's really just validating the handpiece. Okay, so now we're going to start on her lateral cheek. You'll notice I did not remove her earrings because it's IPL. With laser, we have to remove anything shiny. With IPL, because it's a diffuse light, that is not part of the protocol. I'm going to take my handpiece, put it on the skin. This is going to be my first pulse, Beth. You okay? 1, 2, ready. Okay? And I'm going to do one more above it. Now I'm going to wait a minute and I'm going to see my tissue response. What I'm looking for with this IPL treatment is for the redness and the brown spots to grab the light. I want to see generalized erythema, which I'm seeing. I don't want to see the mark of the handpiece. That would be too much energy. If I didn't see any generalized erythema, I would go up. I feel this setting is actually perfect for her. I'm seeing generalized erythema, and I'm ready to proceed. Now, there are very different patterns you can use when you're doing IPL. I usually start with my test on the lateral cheek. Always test on the lateral cheeks. When somebody looks at you, if you overtreated somebody, you don't want a big patch right here on her cheek. So always use the lateral cheek, not in a visual axis. Then come over, we overlap 10%. We're gonna put our handpiece down, hold our elbow up, and here's our next pulse, Beth. 1, overlap 10%. And we're just gonna kind of go over the whole skin. What's nice about IPL is that it is so this is a small handpiece, but you're covering a pretty nice area each time you treat. Are you comfortable? Does it feel prickly or hot?
Hot.
Hot, okay. So now, we're gonna turn it down a little bit. That's my trigger. Usually I ask if it's prickly or hot. Usually it is prickly. You think it does feel warm to the touch to you?
It's definitely prickly, but there's a very strong hot sensation.
Okay, now I'm gonna look at my tissue response. Generalized erythema, it is getting a little redder. So let's go down 1. I'm gonna listen to my patient. I'm gonna put it in standby, and I'm actually gonna go down to 16 joules. And back in ready mode. Okay, now I'm gonna do another quick test on her and see if it's more comfortable. Here we go. How's that feel? Better? Okay, good. Now, sometimes when we're doing the chin, she has a little cleft in her chin. If you have the patient put her lower tongue over her lower teeth, you have a nice flat area to work. Okay, so I usually do the whole left side, then come around with my left hand and do the other side. So now I'm going to come across her forehead. And this might be a little stingier because the skin is a little thinner here. Okay, now I'm going to have you go to the side. And I'm going to come over and use my other hand. If you don't use both hands, you just have your patient turn a bit and they're just fine. Now we're going to start on the chin. 1, 2, 3. Still doing okay, Beth? When we get to the chin, you want to take the handpiece and bring the skin up. Take the skin and bring it up so that you're not stretching at the edge of the chin. The green light, which you see coming out of the handpiece, must be flush against the skin. If it's hanging off in any way, it can cause a little hot spot. Okay, good. You're almost done. You hanging in? Okay. Now, we weren't going to do this corner of her forehead, so I'm just going to do a couple above it. Because I want to pre-treat her there. And then I'm going to come over and show you how I do the nose. What you want to do is lightly pull the nose to the side, kind of push the skin into the side of the handpiece. Line up your handpiece beside the nose. I'm sorry, that's stingy because it's your nose is a very vascular part of the body. 1 here, 1 here, and I'm going to do 1 right on the tip here. Good. Now I'm going to take a look. So I have good erythema here. We also have some blanching here. What I'm looking for is, did the little lentigos, which these are the little lentigos, get darker in color? And they did. See how they're a little darker? Here's 1, here's 1, here's 1, here's 1. She didn't have as much vascularity as she had pigment issues. I'm going to do 1 more over here. Good. So Beth, what I want you to do when you get home is take a look in the mirror with me. You'll notice that this side of your face is hardly red because that's where I started. The other side of your face is still red. That will dissipate probably within the next hour or so. I want you to take 2 washcloths that are wet in the fridge in a Ziploc, or a bag of peas in a Ziploc if you want, whichever you have at home. And just put that over your face. It'll just calm it, keep it from having any swelling. As I mentioned earlier, when we do these light treatments, it makes you a little photosensitive. So it's important for you to wear that broad spectrum sunscreen. And we're gonna, as you leave here, we're gonna take you in another room and cool you down for a bit, okay? And then we're gonna put some sunscreen on when you leave. And then we're gonna make an appointment for you to talk to the esthetician about adding the hydroquinone, which will really make everything work together. Okay?
And do I want to wear makeup within the 2 weeks?
You absolutely can. That's the beauty of this. It's non-invasive. I encourage you to wear makeup. They have some great makeups now with sunscreens in them, which are good products, kind of a one-and-all product. And that's a great thing to wear because you put it on in the morning when you get up. If you're busy and you're running around all day, it's perfect. That would be ideal for you. Okay? Thanks for coming in.